What has changed in the health service since 2010, and who is to blame for the state of it today? If you work in the NHS right now, if you have worked in the NHS at any point over those 15 years, you will go right to the top of the queue. I'm really, really interested to hear from people who have got some insight into this, because I appreciate there's lots of different things here. I appreciate we've been through a pandemic. I appreciate that we've got an ageing population and a growing population and all of those sort of longer term factors. But if you have worked in the health service, what would you pinpoint as the biggest 1, 2, maybe 3 things that you think are responsible for the fact that 14 years ago, 70% of us thought it was doing well, and now only 24% of us do? Because we've all experienced this, haven't we? I think very few of us are of the view that the NHS is doing well right now. We've all experienced the hours seemingly on hold to the GP, the paperwork that goes missing, the bureaucracy, the chasing up some document that any vaguely functioning organisation would have had online rather than being handed around a hospital in a beige folder. We've all had to deal with the cancelled appointments or the surgeries delayed, and the story goes on, doesn't it? You know the rest. And that's despite the amazing work that NHS staff are doing. It's despite the many things that do go right, the lives that are being saved every day, even as we speak. And yet, despite all that, despite the best efforts of NHS staff, it just isn't working. The government blames the pandemic. They blame the strikes. Who do you blame, and what do you blame? Or is it just the case that we've got to accept that with a country this big, with this many people living longer, the NHS is not fit for purpose, that we need to have a more honest conversation about whether we can actually afford it going into the future? Call me, particularly if you worked in the NHS, but if you've got views on that more generally, would love to hear them. What's gone wrong in the health service from your perspective, whether as a patient or whether as someone who works in it? This text from Phil. Ben, the state of the NHS is totally down to Tory austerity, nothing to do with the pandemic. It was failing years before. That from Phil in Accrington. Is that right? Or is that lacking something, in your view, that explains what's gone so wrong? Let's talk to Dr. Phil Whitaker, GP, medical editor of the New Statesman, author of What is a Doctor? A GP's Prescription for the Future of the NHS. Phil, great to have you on the programme tonight. Thanks for coming on. I'm going to start, if I may, with that text from another Phil in Accrington who says this is only down to Tory austerity and a lack of funding. Is that too simplistic an explanation, or is that the truth? Good evening.
Good evening, Ben, and thanks very much for having me on. Yeah, do you know, I was listening to the feed in and heard that text from Phil, and I thought, God, have I sent that in myself? Because there's an awful lot of truth in what's said there. And essentially, as you were saying in the introduction, 2010, we had the best public satisfaction figures on the NHS that we've had in its history. And here we are 14 years later with the worst. And those things neatly sort of top and tail the political change in the country. What's really happened over the austerity decade is that the kind of funding of the NHS has been squeezed. So there have been increases in the funding, but well under what the kind of historical sort of average would be. So a real terms funding squeeze. And in order for that kind of funding squeeze to sort of be weathered, if you like, what's happened is there's been a decimation of community and primary care. So general practice, district nursing, health visiting, social care. And essentially the hospital sector has grown because it's protected, because it basically earns its money by its activity. The more patients who go in, the more money the hospital gets for the work they do. Whereas all of us out in the community are paid on block contracts. So we just get a certain amount of money. And when you've got to save money in the NHS, you think, I'm going to shave that block contract because I can. So we've been losing staff. So probably today now, in the population at large over the age of 65, we've got about a third more people than in 2010. In terms of hospital doctors, we've got a third more hospital doctors. They've kept pace with the highest users of the health service. In terms of GPs, we've got 10% fewer.
Wow.
So we've lost GP numbers. So probably where we should have 10 GPs now, we've got about 6. So there's just not capacity. And the problem is that the needs of people for healthcare don't disappear just because there's no capacity in primary care. The needs are still there. So when there's no capacity, those patients by and large go into the hospital sector where everything's more expensive. Often inappropriately. They don't need to be there. They could be dealt with if we have sufficient resources. So that's kind of what austerity has done, is it's disproportionately skewed the NHS away from the community and primary care and funneled resources into the hospital sector. Hospitals fantastically and are really important and very useful when you need them. But they're currently dealing with all sorts of stuff that could be handled out in the community if we had the capacity out here.
Phil, I wonder how that's affected you personally, you know, having fewer of your colleagues, more patients to treat. How has your job as a GP specifically changed over the last 15 years? What differences have you noticed?
Yeah, so I mean, I qualified in medicine in 1990 and I became a GP in 1995. So I've been around for a few years. And I lived and worked through that period of time, sort of 2005 to 2010, that kind of period of time when satisfaction was absolutely at record levels of high. And it was an absolute joy to work in the NHS. It purred like a Rolls Royce. Patients could access me very easily. If I needed tests and investigations, I could get them done within 6 weeks at the outside. If I needed to refer somebody for specialist care, that was going to happen in a timely fashion. They'll be seen within 6 weeks. If there was an operation, that would be done within 18. And it worked, and operations weren't cancelled. And, you know, it was just a brilliant time to work in the NHS. What's happened is this kind of slow motion car crash, basically. And it's that old analogy of the frogs in the water, you know, it's getting hotter and hotter. You don't really realize it until you look back and you see, oh, crumbs. Okay, look where we were and where we are now. It feels incredibly embattled. It's really demoralizing. I mean, I was incredibly proud of the care and the service that the NHS delivered to patients. Switch on my radio this morning, I'm hearing the latest British social attitude survey saying how few people are satisfied. I don't blame them. I absolutely get it. And that's really demoralizing because, you know, we can as a country do this. We've done it in living memory, in my working memory. And to see what it's become over the last 14 years, it's very, very depressing.
I wanted to ask you about that idea that we can do this, Phil. There are people that say it's just not sustainable. We're already paying record levels of taxes, as you say, there's record levels of funding. It's barely, you know, it's scratching the sides in terms of the demand in the NHS. With an ageing population, with a growing population, is the NHS something that we can afford in the years and the decades to come?
Yeah, unequivocally, yes. And it's interesting. So, again, I mean, the book that I wrote was trying to take a kind of bit of a historical view. So I've kind of encompassed the whole of my time as both a medical student and all the way through my career. And certainly when I was a medical student in the early years of being a doctor, there were long waiting lists. There were lots of howls and the NHS, oh, it can't be afforded and it's a bottomless pit. And so I've heard all this before and I've seen all this before. What happened under New Labour, the Blair and then Gordon Brown governments, was that they targeted just a certain amount of increase. So we went up to around about 10% of GDP spend on healthcare from about 7%. So yes, a significant sum, but not breaking the bank. And it created the capacity for that level of service. And I think the idea that the NHS is a bottomless pit, you can just put any amount of money in it will never satisfy, is wrong. And we've seen that that's wrong. What you do definitely need to do, and I absolutely agree with people like Wes Streeting, is you've got to spend the money wisely. And we are unbalanced at the moment. There's so much activity in the hospital sector and so little capacity and activity in the community. And that includes social care as well. And if we are to get the NHS back on track, we've got to get that rebalance. So it's not just about the money, it's what it's spent on and where it's spent. And the community is the cost-effective bit. And we can deal with the vast majority of healthcare needs in the country out there in the community if we've got the capacity. And then the people we send into the hospital sector, they really need to go there. They benefit from it. They're just the people that that's designed for. And we've got to get the balance back.
When government ministers say we've been through a once in a century pandemic, we've got crippling industrial action and strikes, Phil, are those just excuses? Is that just buck passing from the government? Or is there something in that too? Because when you look at the figures, yes, satisfaction's fallen, but it's fallen especially quickly since 2020 and COVID here. Is that a sign that there's something in that, or do you not buy it?
No, of course, the pandemic cannot be ignored, absolutely. But Phil from Accrington was absolutely right. This decay and decline was all in evidence in all the figures, particularly acceleration from 2015 onwards. Okay, so it was all there in the pandemic. My best analogy for this is that if you have a car, you're running a car, and you just think, all this servicing that I'm paying all these hundreds of pounds for every year, it's a lot of money. I need to save that money, so I'm just not going to do the servicing. You'll get away with it for a year.
Right.
You'll get away with it for 2 years, 3 years. Then if you take that car and say, do you know what, we're going to do the Paris to Dakar rally now, it'll fall apart by the end of the road. And the pandemic stress tested the NHS, but it was in a parlour state. It hadn't been maintained and serviced for several years, and it suffered.